Welcome to another episode of Medicine Simplified. In this video, we will know about classification of bone tumors. Bone tumor is an abnormal mass or lump of tissue that forms when cells within the bone divide and grow out of control. They can be benign, which is non-cancerous, or malignant, which is cancerous. Can be caused by secondary metastasis, that is from other organs like lungs or kidney. Coming to the classification of bone tumors, first type is bone forming tumors, which is subclassified into benign, which include osteoma, which develops in skull and facial bones, osteoid osteoma, which develops in long bones and typically smaller than 1.5 to 2 centimeters. Next is osteoblastoma, which is the most common benign bone tumor. Example is giant osteoid osteoma. Second subtype is indeterminate bone tumors, which include aggressive osteoblastoma, which is rare and aggressive. Third subtype is malignant, which include osteosarcoma, which affects long bones, periosteal osteosarcoma, which is rare and tumor is formed on surface of long bones. Osteosarcomatosis, also called as multifocal osteosarcoma, which is rare and highly aggressive variant of osteosarcoma. Next type is cartilage-forming tumors, which are further subclassified into benign and malignant. Benign include osteochondroma, which is abnormal growth of cartilage, develops near growth plate of long bone. Next, in chondroma, develops from cartilage inside the bone. Chondromyxoid fibroma, it develops in metaphyseal region of long bones. Chondroblastoma, originates from immature cartilage cells. Periosteal chondroma or juxtacortical chondroma, it develops beneath the periosteum of bone. In malignant subtype, chondrosarcoma, it is a rare, develops in bones of pelvis, femur and humerus and classified into primary and secondary chondrosarcoma. Next type is giant cell tumors, which include benign giant cell tumor, indeterminate giant cell tumor, malignant giant cell tumor. Giant cell tumors are rare but locally aggressive tumors that develops in end of the long bones near joint. Next type is marrow tumors. Tumors originate in bone marrow. Most of them are malignant, which include Ewing's sarcoma, which is rare and aggressive form in bones or surrounding tissue. Next is plasma cell tumor, occurs when abnormal white blood cells multiply and form cancerous tumor in bone. Next, multiple myeloma, the blood cancer that originates in bone marrow. And last one is lymphoma. Another type is vascular tumors, which are further classified into benign and malignant. Benign include hemangioma, tumor made up of abnormal cluster of blood vessels. Glomangioma, it is a mesenchymal neoplasm, develops in fingers, feet and long bones. In malignant subtype, angiosarcoma, it is a rare, originates in lining of blood or lymphatic vessels. Next type is fibrous tumor, which are further subclassified into benign and malignant. Benign include non-ossifying fibroma, which is common in child and adolescents, occurs in long bones and usually resolves after child growth. Next is desmoplastic fibroma, which is rare but locally aggressive primary bone tumor. Next is ossifying fibroma, which is rare, affects jawbone and craniofacial area. Malignant include fibrosarcoma, which is rare, aggressive form of soft tissue cancer, which originates in connective tissue. Malignant fibrous histiocytoma. This tumor composed of mixture of fibroblasts and histiocyte-like cells. And there are other bone tumors. Benign include neurolema and neurofibroma. These tumors arise from nervous system. Malignant, which includes liposarcoma, soft tissue cancer that originates in fat cells, and undifferentiated sarcoma. It arises in soft tissue or bone, named undifferentiated because cancer cells are primitive, that they don't resemble any specific type of normal tissue, making difficult to classify. That's why it is called as undifferentiated sarcoma. And last one is adamantinoma. It is a low-grade malignant bone tumor, exclusively affects the shin bone or tibia. There are some lesions that resemble tumors, which include bone cyst, classified into simple or aneurysmal. Next is fibrous dysplasia, classified into mono or polyostotic fibrous dysplasias, reparted to giant cell granuloma. Next is fibrous cortical defects. These are not true tumors. If you like this video, please subscribe to our channel. Thank you.